Good morning. My name is Siring Somo, and I'm the moderator for today's session. I currently work for the YWCA Toronto as the Director of Employment and Training Programs. I'm also the current co-chair for the Ocasi Women's Caucus. Before we begin this session, I'd like to take a moment to make our land acknowledgement. I acknowledge that the land we are on today is a traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13, signed by the Mississaugas of the Credit, and the Williams Treaty signed with multiple Mississaugas and Chippewa band. So today we have with us some members of our Ocasi Women's Caucus who will be sharing information about the impact of COVID on our women's organizations and specifically on the female staff and our participants. As many of you know, Ocasi Women's Caucus is comprised of about 38 plus members and forms about 16% of the total membership of Ocasi. So we have four speakers, four panelist members, Fatima Philippi from Rexdale Women's Center, Deepa Matu, Barbara Schleifer Commemorative Clinic, Sultana Jahangir, South Asian Women's Rights Organization, Olivia Bresno, Windsor Women Working with Immigrant Women. And I will introduce each of them before their individual presentations. Each speaker will be given up to 10 minutes to share their thoughts. Following this, we will have a few general questions that we'll address to each of the speakers. And we hope that we will have enough time and opportunity to address any questions that may come up from the attendees of the session. In terms of housekeeping notes, I just wanted to let everyone know that this session is actually a webinar. So we would really like to request our attendees, if they have any kind of comments or questions, to enter it into the Q&A area of the stream area. And we'll ensure that we can try and have our panelists respond to any of the questions that might come up. The goal of this session is, of course, to identify the needs for support for women's organizations, as well as for women working in our sector, and also specifically formulating some recommendations to the Ocasi Board of Directors, and through them, also to governments, funders, and policymakers. We will be sharing a poll later on, and we will also share how you can participate in that poll as well. So without further ado, I am going to introduce our first speaker for the panel, Fatima Philippi, who is the Executive Director of Rexdale Women's Center, and she oversees a staff of more than 80 and provides services to more than 13,000 individuals on an annual basis. Fatima has extensive experience working with not-for-profit boards of directors, networks, coalitions, and partnerships. She has served on many boards of directors of provincial and service organizations such as Ocasi for various terms, as well as the Rexdale Community Hub. And currently, Fatima is the co-chair of the Ocasi Women's Caucus. Fatima will speak about the concerns and needs of women's organizations that we have heard through our Ocasi Women's Network. So over to you, Fatima.
Good morning, everyone. Thank you, Tessering. Sorry, I'm just going to get through so I can share my screen with the group. Hold on a second, and I can get this up and running. Hope everyone is doing well and that we're all having a good day. It's nice and sunny here in Toronto, and so hopefully you're having a good day where you are. So thank you. I'm just going to, hold on, start my PowerPoint here. Okay, so not going to talk. The reason this is up is that it's going to be available later on. So whatever you want to read later on, you're welcome to do so. Just talk a little bit about my organization. We were established in 1978 and we provide a variety of services for women. And last year we saw over 13,200 clients come to the organization. Just wanted to talk a little bit of overview of the sector. So to put our conversation into context is the fact that, we are a very large sector here in Canada. We have a lot of power and a lot of force. Sometimes it's not necessarily recognized. And you can see here that there are over 170,000 organizations across Canada, and we employ over 2 million people. In Ontario alone, it's over 1 million. And the fact that the majority of our workforce is female, so you can imagine what that means for women in working women in Ontario. And there are 3 areas in where most that nonprofit organizations are situated. They're either serving households, there are businesses, or they're working with governments. As I said that before, what's really key here is that the fact that our sector is predominantly female, we're not recognizing the fact that we have special needs, and we need to focus our attention on what's happening with women in our sector. And I put up a quote from the Ontario Not-for-Profit Network talking about decent work, and it's an excellent report. If you're interested, I can share that in the Q&A later on and let you know what that report that was just recently released in July 2020. And it talks about the gender stereotypes that position women as natural caregivers, and the fact that this is what reflected in society, but it's also reflected in the work that we're doing. So I think the two are kind of hand in hand and interconnected. They're not separated, and that what women that we are seeing are experiencing, we ourselves as women in the sector are experiencing. It's something that we don't necessarily recognize. One of the things we want to talk about is the fact that as similar to the women that we are serving, our compensations are also low. And the fact that this also impacts the stability of organizations, and women-led organizations, women-run organizations, makes it harder for us to be able to do our job. And now that we have COVID, the impact is greater and becoming more difficult for us to manage. So I think just to give you a bit of sense of what some of the data that's there about women in the organization, and the average compensation, this is actually done through Ocasie's salary survey. And this is the reality of what it's like to work as a woman in our sector, and as leaders and as managers and executive directors in our sector. Just in context, the Ocasie membership right now consists of 238 organizations, and of which 38 are women-specific, women-focused organizations. So we represent 16% of the membership. We know that 162 out of 236 at the time in 2018 are women-led. And it's not surprising, and we're seeing that. And that the total number of male-led organizations is 74, and we make up the majority of the leadership in our sector. And yet we still have those struggles that we face on a day-to-day basis. So as you can see, that Ocasie, 69% are women in our sector, and that's really very, very, very telling. And it's not surprising when we go to conferences, when we get together, the majority are sitting in the audience tend to be women. So if you look at, where we are at, we are struggling with many of the same issues that our clients, and I've been hearing this anecdotally from talking to the women that I work with in the sector. As the co-chair of the Ocasie Women's Caucus, we're hearing the fact that already we were overworked and poorly resourced, and that COVID has added to that. Many of the organizations rely on fund and revenue generation, and that has impacted their ability to deliver what they can based on the reduced resources and finances that they're having. Staff, are juggling work, family, education, digital access responsibilities. There used to be that, that whole concept of work-life balance. Well, it's just gone out the window. There is no work-life balance right now. If you're sitting in your living room or in your kitchen and your children are coming in and out, the challenges become greater for women in our sector. The fact that they're also the teachers at home working with their children and sharing computers or laptops and digital devices that will help their children to access education. And then how do you deal with the fact when you have to connect with clients who are also experiencing the same challenges? So we're seeing staff burnout becoming a bigger issue, and mental health stressors for our own sector. And as leaders in our sector, we're supposed to be those role models. We're supposed to be the ones supporting our staff, but who's supporting us? Where are we getting our supports? Where are we finding ways to alleviate our stressors, and how we manage that? And so COVID has really, really highlighted this, that we don't spend enough time taking care of our own mental health and taking care of ourselves so we don't burn out. And quite frankly, I'm hearing a lot of people retiring, women in our sector who finally just said, you know what, I think it's time now. And it's a good decision to be making, but I think COVID has certainly pushed people to make that decision sooner rather than later. I've seen people canceling vacations or not taking vacations at all. And at first people said, you know, where am I going to go? I can't take vacations, but it's important just to take a break from your laptop or your computer. But what we're finding is things are coming at us fast and furious. I don't know about the rest of you, but just in the month of October, I submitted 4 grant proposals on top of reports to our funders. So it's very, very stressful. And so you say, you know, you have to juggle and make that decision. Do I submit this grant proposal that'll help our clients to get the services that they need through COVID, or do I take my vacations? And if you don't have the capacity within the staff resources to juggle that, it becomes harder. And women-led, women-focused organizations don't have that kind of infrastructure to be able to help them to do that. So I think the fact that we're seeing people cancel vacations and women in our sector, excuse me, taking not taking the time that they need to regroup and to have a mental health break is critical. Again, there is no privacy to do the work that you do. Some don't have the luxury of a separate room or a separate office. And so it becomes harder to juggle that around the need of the work of the clients and to be able to provide for privacy and confidentiality. So we worry about that. And how do we stress that? As I said here, staff resigning and leaving prematurely. It's, you know, I know my own organization, we've had that. And it's not surprising, but yet surprising. The other issue that we're hearing across the board, and women's organizations are you know, I think are suffering a little bit more than most because of the fact that we already were under-resourced to begin with. And so having digital equipment or digital access, computer equipment to provide virtual services has become harder and more challenging. And so the struggle becomes, do I provide that in-service support where you're putting yourself at risk, or do you provide that through a virtual service and be able to provide the clients with that support that you need? So trying to also balance a safe working environment for our own employees as well as a safe environment for our clients becomes critical when you don't have access to the resources and the equipment that you need. And, you know, so you may have computers or laptops for your staff, but you may not have VPN. You may not have the right internet speed in order to support that access to the system that's integrated for your employees. And that becomes very challenging. And, you know, just an email server and a VPN server alone is starting at $5,000. We're not talking about configuring. We're not talking about building that to configure it to the organization. So it's very expensive. And do you have that kind of resource available to say, okay, now we're going to pivot and transfer and go to that new approach? And for those who have had that, you know, you may have some aging equipment, may not necessarily support some of the new technologies that we're seeing right now. The other concern is also becoming for safety and security of data. That, you know, we are always concerned about cyber attacks, ransomware, and, you know, do our employees and do our staff and does the organization have the right antivirus system in place? So those become huge worries for leaders in our sector. And how do we manage that? How do we get that? And how do we protect our client data safety and our staff safety and their data safety? So those things are becoming huge struggles for us as part of this whole COVID on the sector. And I know that we've always had a resistance to going virtual because some of, you know, our clients really appreciate that personal and a personal interaction and a personal experience with the worker. That's a lot of building of trust and a relationship that we have with our clients. And the same with our staff. You know, that personal interaction helps us to build that trust and relationship that's really vital to smooth functioning of the work that we're doing, and also to be able to support our employees. So, you know, we're finding Zoom meetings, go-to meetings, where, you know, we're doing weekly check-ins with everyone and, you know, doing wellness check-ins with our staff. And again, our concern is, do our employees have the right security systems in place in order to be able to do that and not to worry about some data breach or some ransomware that's going to take over their personal computer or or infect the organization's servers. So those are real concerns as a sector that, and particularly women's organizations who haven't had those resources, who don't have the IT support and don't have the resources to fund those IT supports. Those are really big issues that we're struggling with. The other side, on the more human side, is, not only are our clients becoming ill, they're also dying from COVID. I know in my community in North Etobicoke, we have a very high rate of positive COVID cases. And we also have a large senior population. We have a large population of racialized immigrants and newcomers who work in the essential sectors, such as long-term care facilities. So for us, that's becoming an issue. And also the fact that some of our staff who are also involved in the community and other things, some of our staff volunteer in places where they worship. They also volunteer in other organizations. And so they're also putting themselves at risk. And we've also had, in circumstances where our staff have become sick, not while at work, but while they're all doing their own business and taking care of their lives. I hear from my own staff trying to juggle family health responsibilities, and whether it's here, and it's even worse when it's overseas, because you can't get to them and you can't deal with them, and it becomes harder for us to say, how am I going to manage with my family member being sick somewhere else and I'm here and I can't get to them? And so those are adding to the stressors within our sector. And for women's organizations that don't have the infrastructure to support that, sometimes it becomes very, very challenging and very debilitating for our staff to be able to deliver the work. I've been hearing a lot of sense of feeling guilty in not being able to assist the clients as they need. There have been concerns about, I know in our community, poverty is very, we have a high rate of poverty. Food security has become a very, very, very big issue. People have lost their jobs or they were laid off. And so food security for those who are most vulnerable has become critical work for us, and how do we get food to people that need it in a timely manner. So, those are the kind of guilt factors that, a lot of our staff are experiencing, that we can't do as much as we would like to do for our clients. And the fact is, sometimes we're struggling just as much as they're struggling. And we've also heard that within our own sector and within the women that we are working in this community, that they've also experienced domestic violence. It's not a surprise. We're seeing people stuck at home, and if you already have extenuating circumstances putting pressure on the family, financial pressures, loss of job pressures, change of roles and responsibilities. Sometimes the woman might be working, but their male partner might not be working. And so that leads to sort of a breakdown in the family dynamics. And we know that we've been hearing from women in our own sector experiencing domestic violence. And how do we, as women-led, women-run organizations, support our employees to make sure that they don't fall into precarious situations where their lives are at risk? So I think COVID has opened that Pandora box that we would never have expected in so many ways that we would never have imagined. And that's it.
Thank you so much, Fatima.
Sorry.
Take a little more than 10 minutes, but certainly this is really important issues that you've brought forth. And we hope that later on, in the Q&A, you might be able to even expand on some of these topics. Thank you so much, Fatima. So next on our speakers list, we have Deepa Mattu. She is the Executive Director of the Barbara Schleifer Commemorative Clinic. And as the Executive Director of the clinic, Deepa has 20 years of legal advocacy, social justice reform, direct human rights service provision, and public education experience that she brings to this experience. Deepa's previous experiences includes Director of Legal Services at the clinic, staff lawyer, Executive Director and Project Coordinator of the South Asian Legal Clinic of Ontario. Deepa will speak about gender-based violence and its impact, again, on women and our sector. Over to you, Deepa.
Thank you so much, Sirang, and thank you, Fatima. It's a great segue into what I'm going to talk about. I am trying to move the PowerPoint. It's not happening, so I will let our tech support help me here. Meanwhile, just to start off, I am at Barbara Schleifer Clinic. As Sirang just mentioned, I am a lawyer by profession. The clinic is a downtown clinic. But we provide services across Greater Toronto area as well as Ontario-wide and in some cases nationally. We provide legal services, we provide counseling, we provide interpretation in over 200 languages, and we have a lot of special projects, including one on criminalization of women, risk assessment, and another one on case management. We serve around 9,000 women from diverse communities each year. We have served over 80,000 women since 1985 when the clinic came into existence. When we say women, it's an umbrella term, and we recognize that gender is a self-identification and does not necessarily correspond with their assigned sex at birth. It represents all those who self-identify women, including but not limited to cisgender women, transgender women, intersex, and two-spirited women. Talking about gender-based violence and its impact, I think what is interesting about gender-based violence and something that we all know is that systemic racism, precarious immigration status, language barriers, and fear of criminality or children aid involvement all are examples of the barriers that might result in women being suspicious or unable to access the police or the criminal legal system. And this was pre-COVID. It is not something that has happened new. This is not something that we are experiencing just now. It was always there. What COVID has done is it has created more complexities in these very same situation. If you just look at the global stats, 1 in 3 women worldwide experience physical or sexual violence, and most of the time by their intimate partner or people they know. Yet when they do, and the state or an agents who are their conduits to this first system, they perpetuate stereotypes, they fail to provide safety or traumatize women. The state is essentially maintaining their structural vulnerability to abuse and exploitation. And I'm using state as the construct because when it comes to state, the legal system, the social system, the health system, all are part of that state. And in some ways, we are also part of that system, although we all advocate for the improvement of the system day and night. Another important thing to remember when it comes to gender-based violence is that male perpetrators may also take advantage of their knowledge of the system and report women to preempt them, showing evidence of self-inflicted, defensive, or unrelated wounds. So that's why we see a lot of women criminalized when coming forward or framed into criminalization when coming forward with their experiences of abuse. We also have seen the impact of mandatory charging on the racialized and immigrant women, and we have seen how an increase in more women being charged or dual charging happening or abuser manipulating the situation in their favor. Moving along, if we look at what is the migrant women's experience overall and how precarious immigration status actually interacts within the gender-based violence experience, I think it is important to remember that immigrant women, refugee women, and non-status women experience the same form of violence in their intimate relationship as experienced by Canadian-born women. So we are not trying to say that there needs to be a homogenization of the migrant women for their experience of violence. But I think what is important to understand is that they face barriers such as language, such as access to resources when it comes to this form of violence. Can someone please tell me if I'm still audible?
Yes, you are, Deepa. Yes, you are.
Okay, my screen just was blanked out for 1 second. It's back. So newcomer women abused by her spouse or partner may also suffer forms of abuse that are unique to the newcomer experience. There is a graph here, which all of you, if it is visible to you correctly, you can see that how status is also a fluid concept. A woman can come as a refugee claimant into the country, and once the claim is rejected, she can become non-status. Similarly, a temporary worker might come, and when their work permit expires, they become non-status. So non-status, which is the part of this central point of this graph, is that no man's land kind of area where people can go between the statuses. So it's not necessarily that someone stays in one status, but the impact of that definitely creates a huge barrier for women. Some of the other things that we see continuously in our work, and all the women organization, including the clinic, sees it, that many migrant women fear deportation, and even if they have a right to remain in Canada because their partner or their families keep them uninformed of their full rights, they do not access resources. One of the things that we have seen continuously with all different forms of statuses is that there is a power imbalance in these relationships. Just because someone is here on a permit or someone is here on some kind of precarious status or trying to get a status, that inherent power imbalance in different relationships, including intimate relationships or worker and employer relationship, or a student who is renting a basement, and all of those relationships, we see that power imbalance creates an environment for and breeding ground for abuse in the women's lives. I think we all are aware of the concept of intersectionality, so I don't want to go into too much about intersectionality, but it's important to acknowledge Kimberly Crenshaw's work because she gave us a lens to think about that all these different issues intersect when a woman is experiencing violence, and keeping that lens is really important. Another really important lens to keep is the trauma experience at the intersection of all these barriers, which might be cultural stereotyping in some cases sexism and patriarchy and racism and xenophobia, or all of them together, including the immigration control. The reality remains that both trauma and oppression impact our brain and body in a similar way. So if someone has experienced an oppression of any of these kind, and has been a survivor of violence, they will probably experience it in a very similar way, and their impact of that on their life is very similar. Again, I think I'm trying to emphasize on the point that layers of racialized, gender and xenophobic violence in the women's life, especially in the life of the Black, cis and transgender women by the state, has completely shown a different side of it during the COVID for us. We have also seen that Black women, including trans women, are routinely accused of committing poverty crimes and petty theft, welfare fraud, and all of that during COVID has given us a different level of oppressions that women are experiencing. So what is an important factor to consider for us as service providers? I think what is important for us to think about is individual's trauma. And we have to think about, it could be the event or the series of events or the set of circumstances that is experienced by an individual as physically or emotionally and is life-threatening, that has lasting adverse effect on individual's functionality, which could be mental, physical, social, emotional, and spiritual well-being. So trauma-informed services or trauma-informed framework is important when we are talking about gender-based violence. So lastly, what I wanted to share with you is, if we think about the Canadian immigration legal system or Canadian immigration framework, the stated objective of that whole framework is to pursue maximum social, cultural, and economic benefits, reuniting families, promoting international justice and security by fostering respect for human rights. So that's the broad framework. So within that broad framework, what we feel is, and what needs to happen is, that gender-based violence plus analysis, which can identify how policies can create barriers to determine safety of women, need to be applied. It needs to be applied within the concept of the intersection of gender with other identity factors such as income, race, age, religion. The aim is that this information will support more evidence-based decision-making by both policymakers and service providers, which will result in effective and efficient programming. We would also want to say, from the clinic's work's perspective, as well as the work we have been doing at the Caucus, that there needs to be changes to the Canadian immigration regime that must include commitment to the gendered analysis, recognizing unique pathways and the drivers of migration for women in a system that was designed with the migration patterns of men in mind. It must be emphasized that as a clinic, we see on a daily basis that women's migration is fueled with conditioned primarily by violence. Lastly, what I want to share with you is that migrant women, their status in Canada and their chosen home often is also imperiled. Gender-based analysis is a process that examines the differences in women's and men's lives and identifies the potential impact of policies and programs in relation to these differences. What I can say about the COVID and what all COVID has done, I think if we have room today to talk about it, I think I would like to share that how COVID has emphasized some of the pre-existing barriers, but COVID has also given an opportunity for us to rethink the world. I would end with the quote that that Arundhati Roy gave us, which says that the pandemic is a process through which we can all go through the other side. It's a vessel that we go through the other side with a new world imagined, or we can choose to drag our old biases and discriminatory practices. And I think I would choose the first and try to go on the other side with an open world and a better circumstances for women. Thank you.
Thank you so much, Deepa. Very much on time. Appreciate that. You really raised some really important points that impact the sector and women, particularly domestic violence. You spoke about the precarious women with precarious status and how important it is to both have an intersectional lens as well as a trauma-informed lens. So we hope that during questions you will be able to perhaps answer some of the opportunities and challenges that we might, we might have in this pandemic era. Next on our speakers list is Sultana Jahangir. Sultana Jahangir has been a social service worker and social justice advocate for 25 years in Bangladesh, in the United States, and in Canada. After immigrating to Canada, Sultana led immigrant women from her area to create their own organization, what we now know as the South Asian Women's Rights Organization. And since 2007, Sultana has been the executive director of SORO. So welcome, Sultana. And Sultana will be speaking on the impact of COVID on racialized women, particularly the women that have been served through SORO.
Sorry, Sultana, before you start, I've had a comment in the Q&A for having our panelists slow down a little bit. Sorry, we are speaking a little bit too quickly. We apologize. And if you're finding that the slides are too hazy, there's a slide bar on your right where you can make the slide bigger, and it'll increase your visual aspect of the slide. So just some technical things there. Sorry. My apologies, Sultana.
Thank you, Sherin, for your wonderful presentation of me, and also thank you, the before presenters. You all are awesome, and all the strong lady. I feel so strong when I'm working with all of you. So I just want to start with the things like when South Asian Women Rights Organization born, it's born in a time when there is a crisis in the community. The crisis is that time our unemployment rate of Bangladeshi immigrant women is 80%, and overall unemployment rate of the immigrant and that time is 13%, very close to the pandemic time. So like when we born in this crisis time, what we did first times is like raise the community's concern. SORO totally mobilized to build the women's leadership and economic inclusiveness of these women. We did a big survey very beginning, and we find it out that most of the women are isolated, homebound, but they really want to work, and they bring the asset of their education. So these are the community who are skilled immigrant are living, and skilled immigrant, those whose skill already scanned by the Canadian systems and they're coming in a skilled worker are not getting the job in their related field. So like what happens when they are not getting the job in their related field, they get a huge pressure to work in the precarious labor market, and underemployment is coming. So this mass underemployment is the main problem for our communities people to survive in Canada. The poverty is a pandemic that was in the community before this pandemic is coming. So like when we start in the crisis moment, we support the skilled immigrant women, those who come in this country as a skilled worker, to support them to get the job they immediately qualify for and gradually move in the job, this labor market attachment, support them to build the confidence. And we see it like within 3 to 4 years, some of them are moving to their professional field. Some of them are stuck because of their unique and complex barrier. So like when the pandemic is coming, we feel that the panic situation in the community immediately SORO did activate the community asset. And that is the all community-based ethno-organization capacity, totally neglected by the funders, that we have the capacity, we know what kind of asset in the community. So this asset is international professionals, health professionals person, and all the young generation, women and girls, those who activate to support the community to tackle the lacking of the computer skill, and also bringing the all COVID related information as early as possible and translate it their own language and distribute it in the community, do social media event, Facebook event. Right now, from since March, we do at least 2 Facebook event in a month, and providing all the information, especially health related and economic related information to the community as early as possible with their own language, so then people can navigate these things. And at the same time, what we do, we are in the advocacy platform. We liaise with the government, we talk with the local government, national government, and raising the concern of the community that all the services they provide, all the benefit they provide, it is not universal. It is not supporting all people. Some of the proportion of the people, especially the international students, especially the precarious status women, and also some precariously working women, those who get laid off in December are not rehired. They cannot meet the criteria of the benefit CERB and other. So we continue lobbying for them to see how we can make an inclusiveness, because exclusion of this group of the people will going to create a more contamination in the community. We are watching in the communities all the situation right now. Continue do survey with the women. 1,200 women we reach and talk, those who are precariously work, and they tell us out of this 1,200, 829 already lost their job and get some kind of hours shortage of this time. Very beginning the pandemic, what we did, we sent the message to everyone that they should have to stay home, and we see the women informing us that how they get provoked by the employer, pushed by the employer to working in that times. But we tell them to give the priority of the health issue. Most of the women stuck in the home because of the childcare, and we find it out that they are also not eligible for that kind of benefit because they are leaving the job voluntarily for their family needs. So lots of issue we find it out that it's need to be navigated, information need to come on top right now. We also activate a group of young women and girls to support us to distribute the aid in the community, and also supporting the connected the communities women to existing services that are right now available to face this pandemic impact. We find it out that employment issue is a big issue for the communities people right now. The market is, we see that all of the data, I know the PowerPoint is not moving right now, but it is in the system. Anyone can check it in whole PowerPoint. You're going to find it at all the data. It shows that the poverty rate of the community was before the pandemic is above the Toronto average line. That if the Toronto has 20% poverty rate, in that times our Teasdale and Crescent Town is way above 44%, and also our unemployment rate also way above the Toronto rate guide. Before the pandemic, the inequality systems, it's revealed in this pandemic time, and this reveal, it shows that how important right now to fix the system. Like when government start in March 15, that they feel it like that existing EI system cannot help the worker, mass laid off worker to access the service. They create the immediate system CERB, and then even though like our Prime Minister said that our EI system need to be fixed to meet the 2020 century situation. And that are the things we are saying before the pandemic, that all of this work-related social benefit, all of the system, childcare, EI systems, nothing is working with the meet with the current labor market condition. So right now we find it out that we are in a situation, I'm totally agree with the Deepa, that we need to go in a situation to new world. We don't want to pull out the old world systems with us to out of this pandemic. And we are continue lobbying with the government to make the new system, so that system can recognize the problem of most racialized immigrant women, those who are facing in a huge barrier. The barrier is one from their unique and situation, from their own status as a women in Canada, and also the another barrier from the current accessing pandemic related benefit and all pandemic related health support and economic support. These two barriers make the unique and complex barrier, and this complex barrier should has to be identified by the service provider. We cannot provide one size of service model to all of the people. So like we need a unique and best specialized project for everyone. So they, each of the individual community, and who can do it? Only the community organization can do these things. Where ethno-based organization has a trust already in the community and already have a strong support in the community that we can, utilize, or we can mobilize the community's asset that could help us to do these things. So our challenge is that time, all the organization, like others, we also feel the challenge about the resource, lack of resources, also the stability. We don't know that there is a huge demand for sorrow to serve the community, but we do not have the capacity for these things to support. Another thing is also challenge of the community's people's computer literacy knowledge, social media knowledge. So that we can tackle up right now with the group of young generation. We are right now activate more than 100 young girls and boys, those who are helping their parents to learn how to navigate the computer systems, how to navigate the social media system, how to join with the Zoom to talk with us. So that are the asset for community-based organization like Sorrow that immediately can activate community asset. But we need a support to make us strong, so then we can doing this continued activation to support each other and come out from this poverty. So our recommendation that all the benefit the government is providing and all the support, the livelihood support the government wants to providing, that should has to be universal. I see some presentation last day that someone recognized recommendation about the basic income. Basic income model could be a good suggestion for these things to make the universality, but we would not going to give up all other benefit like our OHIP that is in here long time, no the childcare benefit. So we really need to see that how we can make a best practice or make a very strong net for everyone, so no one fall through by the neck and get affected. If we go to the BC, we find it out that most of the community pandemic contamination is coming from workplace. And we right now see in the community that most of the women who are going to the workplace, and we find it out some of the case that they bring from the workplace to the community. So we are waiting for another big mass contamination that will going to come from workplace communities to community, workplace to the community. And we have to be very careful for these things, and we have to creating some sort of support so people are not feel very pushed to go work right the way to make their life vulnerable and to make the other life vulnerable. So these are the things we want that the government should has to make very inclusiveness for these things. And also that we said that make our hand is strong, we're going to make more community strong. So until our hand will not going to be strong, we can bring the community inclusive and also united to see that how we can come out from this pandemic, because this is the situation that end of the times we need to see that everyone will survive, everyone will going to come, because every life has a value in their family and every life has a value in the society. So our concern, we saw these things that in still, where is the poverty? There is the COVID. So like right now in Toronto, 43% people, those who are affected, they are immigrant. They are racialized, they are poor people, poor area. We saw that pandemic is spread a lot. So government should has to be start to think that how we can invest the resources in that area to support the people, so then they can come out from the situation, they can face the pandemic impact. So these pandemic impacted us a different. We are not ready, because very beginning we get so panic, we find it out that how we're going to survive together in that times. So we as a racial women, we find it out that we lost our job, we lost our economy, we came home, we stay with the children, we got affected by the violence issue, and women take all this unfunded liability of the society. the lost, the caregiver to their children, caregiver to the family member, caregiver to their husband. Everything is done by the women. So these women need a social support from backside. And Soro has the capacity. All the community-based organization has the capacity. All the ethno-based organization has the capacity, because we already build the trust in the community. But we are very unfunded. So I just want to finish because my time is gone. So if anyone has any question, please feel free to ask it. And I'm going to request everyone, please see the PowerPoint, whole PowerPoint, and then you can realize what kind of struggle we are going right now as a racialized women, as a community-based organization. Thank you, everyone.
Thank you, Sultana, very much. And as you've mentioned, your presentation certainly will be part of the session, and people can download all the presentations. We apologize that given time constraints, we have had to have some of our speakers speak in a rush, but certainly if there's any specific questions, we are willing to take those questions once Olivia finishes. So thanks, Sultana. I'm now going to turn over to Olivia. Olivia is the Chief Executive Officer of the Windsor Women Working with Immigrant Women, an active member of the Ontario Western Region Employment Service Networks. She has a background in statistics, finance, database design, and business management. And in the last 18 years, Olivia has worked in the immigrant, women, and employment sectors and has experience in working with not-for-profit organizations, networks, and partnerships. Olivia will be speaking about COVID impact specifically on migrant female workers. So over to you, Olivia.
Thank you, Tesserine. Good morning, everyone. Thanks for the opportunity allowing me to share some of my views. Our organization has properly served Windsor Essex County in the last 38 years. With the federal, provincial government and private funders' funding support, we offer newcomer services to immigrants and refugee women and their families, including language training, mental wellness support, settlement services, newcomer youth art projects, and after-school homework support, women life skills training, employment services, services for seniors, income tax volunteer program, women's circle, and more. According to Windsor CMA data, this year in Windsor Essex County, the population of 15 years and over is near 300,000. During the pandemic, our local economy has been impacted by many factors. Due to the limited of the time, I will just mention a few. As a border city, the border restriction allows the essential travels, which is to support people to across border to attend work. However, non-essential travels have been eliminated. The local hospitality industries are suffering deeply. The local universities and colleges offer study opportunities to the international students. As you all know that many of the international students nowadays are studying in their home countries. The local housing and rental businesses are facing serious challenges. Female employment availabilities are eliminated by their family care factors. This has not been recognized by public general. In our region, we have seen the numbers of our women and immigrant women job seekers reduced significantly during the pandemic. Meanwhile, other demographic groups did not have major challenges. We put out the Workforce Windsor Essex have helped me to put out some data in Windsor, in our region. So in 2006, our female job seekers ratio is 49.5%. In 2011, it's 44.6% of female job seekers. In 2016, 47.9%. In 2019, 43.6%. But during the pandemic, our female job seeker barely made it a quarter of the total number of job seekers. Female job seekers are usually in the traditional years will be between 43 to 49.5%. And the significant drop of the female job seekers have showed us that they are facing more challenges than other demographic. In this May, across Canada, the unemployment rate has just rocked sky high. Canada's unemployment rate in May was 13.7%. Ontario had a similar rate, 13.6%. And in our region, unfortunately, we had a 16.7%. Compared with last year, Canada 5.4%, Ontario 5.2%, Windsor was just hiding 5.7%. So compare 2 years data, the May data, we can see Canada's unemployment rate in this year, May, has increased to 2.53%. Ontario increased to 2.62%. And then Windsor Essex have nearly increased our unemployment rate 3 times. According to census data, there are over 4 million immigrant women in Canada, which means 20% of women were born outside of Canada, and the majority of the immigrant women, which is 63%, live in the large populated cities, such as Toronto, Ottawa, Vancouver. In Toronto, the immigrant women's population is almost 1/2 of the total female population. 83% of immigrant women were living with family members. During the pandemic, we've seen the number of our immigrant women job seekers reduced significantly. Meanwhile, other demographic groups not have such a strong change. Then even without a pandemic, these women's availability to join the workforce is not only limited to their own health conditions, but their entire family's health condition and their family's care request. Often, these women have to sacrifice their career for their family's top priorities. These women's career paths have major interruptions due to the family needs, including caregiving, childbirth, housekeeping, etc. When these women wish to return to work after multiple year gap, they need skills retraining and a longer period for return to work preparation. Also, they will face more challenges, have less job opportunities, and have a comparably low income positions. The employment in Ontario currently is under transformation. The key performance indicators, including 5 groups requiring special support: people with disabilities, Indigenous people, youth that require higher supports, newcomers, and Francophones. But women is not counted as one of the special indicators. As an immigrant, as employment and a training service provider, I would like to help our peer agencies to increase the awareness of the unseen disadvantage and the challenges that women, special immigrant women, are facing. Last but not least, I would like to thank the Workforce Windsor Essex and my team for pulling out the data from StatsCan, Windsor CMA, and our center's years of data to help me prepare this presentation. Thank you.
Thank you very much, Olivia. I appreciate your presentation and also specifically discussing the specific challenges that are in the Windsor-Essex area. Really appreciate that. We now move on to any questions from the attendees, and I see here one comment, question that has been addressed to all panelists. If anybody would like to respond to that. I'm just trying to see here if I can see that question. I thought there was a question from Sudeep earlier, but I can't see that now in the chat. Fatima, can you see that?
Siring, I think the questions that were already answered.
Oh, yeah, they were.
You won't be able to see them.
Sorry, Jeanette, for some reason, I can't seem to answer your question in the Q&A, but I sent you a chat, and the issue that you raised about the women who are homeless taking CERB now being disqualified and having to pay that money back if they're considered ineligible, we will raise that at the Ocasio Women's Caucus and the Ocasio Board of Directors to highlight the concerns, particularly that homeless women are going to be facing with regards to repayment of CERB benefits, which is really not a benefit in the end.
Great. Any other comments? Deepa, I'm sorry, I didn't catch your comment. Could you just say that again?
I just said that the questions that were answered, they're not open for you anymore. That's why.
Oh, I see.
Okay. Sudeep's question was answered in the chat box.
Excellent. Great. Thank you so much. I just saw that question and I wasn't sure about that. So if there are no more questions or comments in the Q&A section, I would like to request each panelist perhaps to share one or two of your best practices during this COVID period, and practices that you might perhaps maintain in the future post-pandemic as well. I'll start with you, Fatima.
For us, even before the pandemic started, we were looking at mental health in the organization as an issue in order to make sure that our employees have the supports that they needed. So we implemented a virtual mental health program through our group benefits program. And that has certainly played a big role in maintaining some of the support for our staff. You can call someone anywhere at any time. You don't have to wait to book an appointment with a psychiatrist or a psychologist. So, and that's available through our group benefits. The other one is really flexible work hours and support. We don't care what hours you're working. We want to make sure that you're able to reach the clients when you're able to reach them and when you have the time to reach them, and to balance that with family and home life responsibilities, and making sure that we can provide them with the right supports, with equipment, virtual meetings, and making sure that we check in on them and making sure that they're okay.
Wonderful, thank you. I think those are really critical points that you've raised, especially health and wellness of our own staff members and how to support them in this crisis, as well as flexible working hours while they are working remotely as well. So certainly. Deepa?
I can think of a few, but if you have to ask me to stick to 2 points, I would say one is we were very successful in getting donation of cell phones and tablets and SIM cards for survivors right at the beginning, although it comes with its own complication of making a protocol and processes. But I think that was a really good first initiative, and we are continuing with that practice so that they can have safe digital access. And the second one, I would say, similar to Fatima's organization, we are giving our staff members a flexible time, but we're also giving a top up for usage of technology. So if anyone happens to be using their own cell phone or their own internet, we are providing a small $30 top up for that usage. And I think that's, again, a very small help, but everything counts in during this time.
Yeah, really important, again, digital access and equipment, particularly to our participants in this era. Thank you, Deepa. Sultana, any best practices?
Our best practice is like immediately we are capable to activate the community resource, like all this international professional health professional person, and including the communities young, like 65 girls and almost 30 young men, to activate them to support the communities people to navigate this situation right now. And we got lots of interpreter in our community, those translate all of the information as early as possible, so then we can do the event and session in Facebook Live and Zoom to support the people to get connected with us. And the same times, like, we get very limited resources from some of this emergency COVID related fund, and we try to distribute the dry food and safety equipment, PPE to the community, that we are continue doing this thing. So we are not that successful like Deepa to bring lots of electronic support to the community, that we still feel like a huge amount needs in the community. Thank you.
Thanks, Sultana. Interpretation services and using intergenerational supports are really critical, one of the best practices, and sort of having a holistic community support out there for everyone. Olivia?
For our organization, we supported our immigrant women clans and also supported our employees. So to support our female immigrant clans, we understand that many of them do not have their own electronic devices. A lot of them are sharing one cell phone or one laptop tablet with their family members. And usually our female immigrant clans, immigrant and refugee clans, do not have the priority to use those. So during the pandemic, lack of the communication create more barriers for them to attending training, obtain services, and also connect to the local social groups. Through the United Way, our organization has received federal emergency community support funds to purchase electronic devices for our female immigrant and refugee clans. Meanwhile, our team have translated a lot of documents related to the COVID and also the prevention documents to share in multiple languages, to share with our female clan, to share with our organization's clans as well. To support our employees, we are doing some minor construction projects to increase our health and safety measures. Our goal is to separate the staff working areas from the client visiting areas, and also canceling all the in-person services and transfer our office operation to home-based operation. So when staff are working at home, not only is the safest way to prevent the community transmission, but also provide certain flexibilities to our staff. So if staff have young children, sick family members, or have to take care of their relatives, people from their communities, working from home can be definitely helpful. In recent 3 months, our home-based operation has achieved over 90% of our regular year's performance. So we are doing our job, but meanwhile, we are taking care of everyone.
Great. No, absolutely really important and critical comments that you've shared as well, Olivia. Thank you. Before I go to my next question, I'm seeing here in the chat, in our Q&A, a question that any of our panelists could answer. And the question is, what, if any, do you think the role of feminism is in advocacy for some of the issues you brought up in your slides? So if there's anyone who'd like to start to answer that question.
Okay, I've answered that privately, but I can certainly answer to that. I think you can't separate the two. I think it's inherent in the work that we're doing that, there's a whole issue out there, feminist or not feminist, feminism, not feminism. And the fact is that this pandemic has affected women disproportionately different than men. And our work has to really focus on advocacy, because if we don't, we're going to lose the ground that we've made over the last 30 years. And it's so easy to fall back and slide back into a role that we fought very long and hard to leave behind, and yet here we are again. And it's amazing that when a crisis like this affects our society, and it comes back that women take the biggest brunt of and bearing the biggest barriers and responsibilities and challenges. So advocacy is absolutely linked with our feminist work and our work with our clients. It can't be separated.
Thanks, Fatima. Really agree with you about the women bearing the brunt of, this pandemic. Anyone else would like to comment?
I mean, for me, I would say that it depends on how you define your feminism, right? So for me, the feminism is intersectional. For me, the feminism means that you are, when you're asking for equality, you're asking for equality for everyone. And the experiences of women is not something that only impacts women. I think it's high time that in 2020, we all acknowledge that when a woman is left behind, our society is being left behind. So I think that's my take on it. I think for me, the anti-racism is being feminist. And for me, supporting transgender community is being feminist. So it all depends on how you approach your feminism. And again, I'm not asking people to convert and believe in my kind of feminism, but I'm a racialized feminist woman and I'm very proud of it. And I think I apply it in every little work I do, and anti-oppression is definitely part of it.
Excellent, great, thank you so much. Yes, Sultana?
I totally agree with Deepa. And my racism, my feminism is like alleviate the platform, because I feel it like when we talk about the gender equality on the top, in the same times we have to think about how we can raise the floor so that every woman will going to be marched together. So like if this work is a feminism, yes, I'm a feminist.
Excellent, great. Okay, so I'm just trying to see if there's any other question here. I think there was one question for you, but I'm presuming you have responded to that. Before we take on some other questions from the attendees, one of the things I really wanted to ask each of you was, we have seen and heard and know that COVID has actually negatively impacted women's organizations and women in all spheres of our lives. However, has the pandemic, is there any kind of opportunities that you see as a result of this pandemic? So who would like to start? I'm just trying to see here. Fatima, perhaps you could start.
Sure, opportunities. Wow. Sometimes it depends on the day and how you're feeling and what the challenges that you're facing. But I think, as much as we hate to admit this in the sector, that, we have avoided this whole concept of working online with clients, that we've taught to ourselves to believe that that personal interaction is what's valued the most. And in some cases it really is. But I think it's pushed us into a new reality where we're going to have to look at how we utilize social media more to work with our clients. Because, I'll give you an example. When we had the Syrian refugees come to Canada, we ran one of the hotels, and never in our mind did we even think about having adapters and chargers. These people were connected, highly connected, and we were not ready for that. And so we had to scramble, backpedal, and figure out a way to support those clients to make those connections. And I think the fact is, as social media plays a big role in the lives of our clients. And so the opportunity is for us to step up and to look at that and how we integrate that in the work that we do. But also from another step back approach is recognizing that the mental health of our staff and the mental health of our clients is equally important, and that we have to give equal attention and equal time to something like this. And that if we don't, we're going to see a sector that's burning itself out very rapidly.
Mm-hmm. Great, absolutely. Pivoting to remote services is really critical at this piece as well, although it has its own challenges as well. I think we can all attest to that. Deepa?
I think this is an opportunity. Like, think about it, that we are all sitting from various different parts of the Ontario and Canada and coming together. So this is definitely something that pandemic has given us the capacity to. We are all doing technical briefings and learning, but we are all learning, right? And some of us had written it off. Some of us had said, I have had enough learning. I don't want to learn one more new technology thing. And here we are. learning it, thriving, connecting. So I think that has been definitely an opportunity. And one good thing about learning is as adults, once you learn something, it's very difficult to unlearn. So I hope we will take this positively and continue. And another great opportunity, I think, or another great avenue that COVID has actually brought forward for us is it has actually confirmed those differences for us that we already knew. It has given us, when they say that everyone has a voice, it's just that we don't hear it. I think we got an opportunity to hear those unheard voices during COVID, and I find that to be fabulous. Black Lives Matter became a global movement. People talked about it in India. People were talking about in South America. So I think that is also something which we have to acknowledge that COVID gave us. It has acknowledged those differences. It has acknowledged that those voices need to be heard. So those are two things that I would say. And again, these opportunities to connect with all these fabulous people. I think we all are way more connected these days than we were ever. I think Siring, Fatima, Sultana, Olivia, I think we all have come together because of COVID. Continuously. So I love that too.
Great, thank you. That's a wonderful comment about connectivity and the global world becoming a smaller world with this connectivity. Thank you, Fatima. Sultana?
I think that it is an opportunity for us to break the system, to build a new system for all the sector, because all the existing system has already inequality and injustices over there. So this is the time we find it out a great opportunity to put the pressure to the political leader, policymaker, that we need a new system. So this is an opportunity. And another opportunity, I find it out that we inside in the community, we get more inclusiveness, even though like we cannot touch each other. Like the senior of the community, those who cannot use the computer, doesn't have a good device. Now, all the young generation feel the urgency to support them inside in the family and also in a social sector. So like in the family, also the, each of the age member are connected together to support each other, to learn these things. And that could be stay after the pandemic to supporting us to get more connected. And these are this intergenerational gap will be minimized, and we understand each other. That will going to create a strong ambience and fabrics in the society. So then we will going to see that we all can together work in here. Thank you.
Thanks, Sultana. Olivia?
Sorry. I think the pandemic have really put our community into a lot of risks. The high unemployment rates and also struggle to stay in businesses, but also created the opportunities for a lot of organizations work together, such as Deepa earlier mentioned. And also in Windsor-Essex region, the City of Windsor and also Workforce Windsor has become our regional leaders in the last 6 months. And they have put up together a project called Essential Worker Registry. So the majority of the local employment and payroll service providers have been the partners of this project. And we work together to serve local job seekers together. This is a new operation model. And I think it just helps us to engage a new model to deliver, to support the local job seekers. I think this is something, the pandemic is it's a terrible situation, but it has put us into the crisis. I have to jump out of the box and leave our comfort and the traditional ways to provide our daily services, but create something new and something wonderful.
Absolutely. Finding local solutions to larger national issues. Really true about that. Thank you. I have one last, I think we're going to have one more question before we go to a poll. We have set up a poll as well. So before, there was this question that came up about, is there a fatigue in bringing up a feminist analysis, so if there's anyone who would like to respond to that. I see Deepa nodding her head. Would you like to take that, Deepa?
I think what Dada and Sudeep are talking about in the chat box is pretty on point. To be honest with you, we have seen different waves which have come to this conversation. We saw the T-shirt feminism happen, and we now are seeing everyone talking about gender-based violence, and the fatigue definitely comes to the people who are at the forefront of it. So I do kind of agree with them, and I do agree that we need to be a little bit more strategic and think about where our impact is getting, especially around the advocacy. But Sudeep and Dada, I'm in a hopeful mood today, so maybe that's why I'm saying it. You might find me on another mood another day, but I do see that we have achieved something. And when I say that, I look at the proposals that come out these days. So Wage, when it puts its proposals, like funding proposals out, it names non-status women, it names migrant women. It actually has acknowledged the language that we have been talking about. So you have to find pieces of successes to celebrate in this work. I think you, Sudeep and Dada, are probably so seasoned, and I respect both of you as feminists. So you know what I'm saying, that you have to take those small pieces of information that's flowing through and celebrate it. Even through COVID, when the government did that big disaster of saying stay at home and not acknowledging us, but at the same time, when they acknowledged that that is a mistake, there was a lot of correction made in the language. There was a lot of backtracking. Yes, we had to be at the forefront, sitting in front of the media and talking about it. But I think that change did happen. It happened quickly. There is a lot of money that has been given to the gender-based violence. It doesn't impact all of us. We all don't see that money. I am with Sultana when I hear that a lot of organizations which do the work actually don't get acknowledged. I am with all of you, but to keep the hope up, I would say we are making a dent, and we are making a dent, but we have to be careful that we don't get co-opted. I think that's where the struggle is.
Great, thanks, Deepa, for responding to that question. There was another follow-up about from Dada as well, asking what is the role of men as allies in advocating for women more than ever, and what can we ask our men? Anyone? Sure, Sultana?
I think we are requesting all the men to give us the space to talk, give us the space for the leadership, because women lead the house, women can lead the society, women can lead the country. Let us lead it. We're going to be work together to make a strong community. If the women move forward, the whole community will move forward, whole country will move forward. So give us the space to show us our leadership.
Excellent. Great. That's a great way to segue into our poll. So as I mentioned earlier, we have two sets of questions, and we would like the polls to begin. To vote for these polls, could you please click on your engage tabs? So on the screen, you should be able to see an engage tab, and on the it's on the view tab, and you can cast your votes. So I am going to request our tech team to put up our first poll. This poll that is going to come up is a recommendation that we are making very specifically to the Axée Board of Directors, and that is to document the impact of COVID-19 on women's organizations and women in the sector. We wanted to know which ones you would like the documentation to support. There are 5 different options, and if none of those, and you can even add another option under the other section. So please take a few moments. We will give you about a minute or 2 minutes to find the engage tab on the view tab and also cast your vote. Wonderful. We can see folks are entering information right here. We have, as many of you may know, 50 participants for this session. So to engage, to go to the engage tab, if you go to the view tab, and on your, when you see the engage tab, just click on it, and you should be able to make, connect to the vote. So we have about 7 people. I'm wondering if others are having struggle to do this. Again, if you can't find how to vote, please go to the Engage tab on the top of the viewing window. You should be able to see the poll. So one of the critical pieces that we are seeing right now is, people are saying that collecting disaggregated data on women really is an important component. Go ahead, Fatima.
Certainly, this is a concern within the OCASI membership. As you know, many surveys come out. Oh dear, my phone is a challenge. Many surveys come out to the sector to talk about data collection, the composition of our staffing, and using that data more strategically and being able to collect disaggregated data about the women's and the women's organizations. And I think that's really important because that helps us to not just have anecdotal data when we're dealing with government, the bureaucrats, but also have real data, live data that tells us what's going on in our sector, and to see how that's impacting women, women's organizations differently or not. And so that's really critical for us in terms of our advocacy and lobbying work and pushing forward, the feminist perspective, and making sure that we don't lose sight of that. So I often get government people saying to me, well, how do you know? How do you know? And we don't know what we don't know, and it's important to know what we do know.
Great. So I'm just going to give a couple more seconds. I'm not sure if people are having challenges finding how to vote. If they are, again, requesting everyone to go to the Engage tab. This is at the top of your viewing window. And you can then vote on this particular poll that we have up here. I'm going to give another few seconds. And again, I just want to let attendees know that these suggestions did come from our OCASI Women's Caucus in terms of the need to document the impact of COVID-19 on women's organizations and women in our sector. So in terms of results, what I see right now is that 87% certainly think the collection of disaggregated data is really critical, followed by the need to document support for staff to address mental health and wellness. This is again followed by, collecting stories and cases of resilience of women and women's organizations at the ground level. The next is recognition of the violence against women in our settlement training programs and services, a response to the realities of the women's lives, and determining if women have lost ground. So, all of them have definitely got 50%, and they should, and then I'm just trying to see if I can see the other, if there's any kind of comments on the others. So, okay, so no other additional comments right now. So we will then now set up the second poll. I'm going to request Jake if he can put up the second poll. And this second poll is through OCASI board, specifically to our governments, funders, and policymakers. There are 8 different recommendations. We also have the option of you adding anything that we may not have included. So please take a couple of minutes to look at the poll and add your thoughts, tick off the ones that resonate most for you. So we certainly have one member. Well, we have a couple more coming up.
Yeah. I've noticed that Tanya Shoot-Molina has put in a comment that you have to select and hit enter. So in some cases that may be why your response might not be registering. So it's just a little side note on a new learning curve for all of us.
I think an important one that many of you are ticking off, obviously, is the need to not only maintain, but also increase investment in services that we offer to our community members, many of whom are in need of these essential services. couple more seconds, and then we will close the poll. And as you can see from the results, I think many of you agree that we need to maintain and increase our investment and funding so that we can continue to offer employment, training, settlement, and gender-based violence services. But also, I think the critical need to prioritize the needs of, racialized as well as marginalized women using an intersectional feminist approach that we have spoken about through this session as well. Yes, then again, we have attendees who have recognized that women should be considered a specialized demographic within the Employment Ontario Transformation Framework, particularly in light of COVID. It was not considered, it is not considered until now a specific equity group, but it certainly needs to, and we need to continue to raise that voice. We also have, comments from everyone saying that we need to raise the salaries of our caregivers, whether they are, childcare workers, elder care, or any other care and dependents. And of course, recognize that essential care services are provided by women. Is a vital component of the economy. And particularly economic growth and recovery. So thank you very much, all of you, for participating in the poll. We really appreciate this. We will forward this to our Ocasi Board of Directors through Fatima, who's on the Ocasi board. And hopefully these recommendations, we hope will be implemented and effected. Wonderful, thank you. So I'm looking at our time, and I think we have about, well, not even a minute, but I really wanted to say a big thank you to all our panelists for the zeal and the enthusiasm with which they've shared their presentations and speaking from the experiences that they've had as women-led organizations. Thank you to all of you for these wonderful presentations. We just wanted to let the attendees know that these presentations will be up and they will be shared so that they can review them later as well. I also want to especially thank our attendees for some of the comments and questions that they've posed to all of us, and has enriched the learning and the session as well. And of course, this would not have been possible without our tech team, Jake and his colleagues, as well as Stephanie, who has been overseeing this overall. And I really wanted to acknowledge our Ocasi Women's Caucus members for their continued, discussions on these issues that is impacting all of us. In particular, I want to mention Sajideh, who is a staff member from the Ocasi organization. So thank you to all of you. Really, really appreciate this wonderful opportunity to speak to each other. Thank you.
Thank you also.
Thank you,
You did a
everyone.
great job.
Have a
Bye.
great day. And
Good day, everyone.
Bye, everyone.
bye.
Good day,
Bye, everybody.
everyone.